Hi, I'm Susana Fried, and with my co-authors Aziza Ahmed and Louisa Cabal, we want to congratulate SRHM on this important contribution to the 25th anniversary commemoration of the International Conference on Population and Development and its program of action. At this time of commemoration, we also want to take a sober assessment of where we are today in terms of government's commitments to respect, protect, and fulfill sexual and reproductive health and rights, and indeed all rights. We wrote this commentary, Tensions and Exclusions, the knotty policy encounter between SRHR and HIV, to explore some of the persistent fractures in our movements and among allies, and to consider how to move forward in solidarity, or better yet, in collaboration. We write as activists who've been part of both of these advocacy fields. As participants in both, we were keenly aware of how, in each movement, we are advancing some rights but missing others. For instance, the ICPD advanced an expansive understanding of sexual health and sexuality and of HIV within a broad SRHR agenda. However, the full scope of gender and sexual diversity has been and continues to be a lightning rod for opposition by governments and by conservative religious and social forces. In this context, SRHR actors continue to struggle with resistance to encompassing the full expression of gender and sexual diversity and integrating key populations. Policy and programming dialogues on HIV, in contrast, proceeded parallel to and sometimes intersecting with that of SRH. The Global Strategy Framework on HIV/AIDS advanced a human rights approach with a commitment to greater participation of people living with HIV. It also insisted on attention to those most at risk of contracting HIV. However, the vertical structure it often promoted, with primary attention to testing and treatment, failed to situate HIV within a broader SRHR framework. As a result, critical SRHR issues have often been included, such as gender-based violence, forced sterilization, and cervical cancer, to name a few. Of course, some within the HIV response have advocated for a more horizontal approach that would center the issue of health inequity and its link to structural inequality and discrimination, for instance, on the basis of race, ethnicity, and migration status, among others. These critics on the inside draw attention to the need to strengthen a focus on prevention, care, support, on primary health care, and connections between HIV, SRHR, and gender-based violence services. However, this remains a minority. From our vantage point, both the SRHR and HIV responses have blind spots that weaken the movements and hamper greater collaboration. So, for instance, the HIV movement has too often ignored the significant impact of HIV on women and girls who were contracting HIV or who were affected by it. At the same time, women's sexual health and rights groups have sometimes offered arguments relying upon essentialist understandings of gender, casting women and girls as a homogeneous group, inherently vulnerable, naive, and uncomfortable with their sexuality. In the face of opposition to SRHR, a still intractable HIV epidemic, and closing spaces for all of our advocacy, it's time for us to untangle the knot. The ICPD 25th anniversary offers us an opportunity to reimagine and realign our approaches to SRHR and HIV. As the SDGs suggest, intersectional approaches may help to divert from conflicts over resources. Our best opportunity is to deepen the collaboration amongst movements, work that is already well advanced. It's time to build on achievements while we address the blind spots in each movement, especially to harness the power and promise of human rights discourse, which has been at the center of both movements for the past 3 decades.